My name is Irfan Aga. I'm a transplant nephrologist. It is critical to maintain a healthy lifestyle, a good diet, exercise, and maintaining a good weight are critical. Indeed, if the patients become extremely obese, they may no longer remain candidates for kidney transplantation. It is imperative that all those who smoke stop smoking. We do not encourage kidney transplantation in patients who continue to smoke. The patient needs to work very closely with their nephrologist and primary care providers. They need to make sure that they are up to date on their age-appropriate cancer screening tests, for instance, colonoscopies, PSA tests, mammograms, pap smears, chest x-rays, etc., as may be appropriate. It is essential that if there is any change in the patient's health status, that the program is notified immediately. This will have a bearing on how we work them up for kidney transplantation. The program must be able to reach the patient at all times. This is of critical importance. When an organ becomes available, time is of the essence, and if we are unable to reach the patient in a reasonable time frame, the organ may be offered to the next available candidate. Therefore, if the patient decides to move or should their telephone number change, it is important that we are informed of that change immediately so that we can update our records. I will introduce you to how the kidney waitlist works. Every patient who wants to undergo a kidney transplant with our transplant program undergoes a comprehensive evaluation. Once they are deemed to be an appropriate candidate, their name is added to a national waitlist. This waitlist is maintained by OPTN, the Organ Procurement and Transplant Network, which is supervised by UNOS, the United Network for Organ Sharing, through a contract given by the Department of Health and Human Services. UNOS is a national non-profit organization that supervises transplant activities in the entire nation.